a little bit of an overview of today's session and the things we're going through. The first thing we're actually going to start with, rather than jumping into the new fancy system, is a bit of a recap and review of why we're actually moving away from the current system. And I think that's really important to kind of set the scenes for why we're moving to the system we're moving to. We'll obviously then look at the new system and, importantly, give a bit of a demonstration of how that's going to look from the patient's perspective, from everyone's perspective. And we'll run through a few different examples of that. And then we'll just close by having a little look at some other support that will be available after today. So let's make a start and begin by thinking about why we're moving away from the previous system as it was. So in order to do so, what we need to do is kind of have a look at what traditional access has kind of looked like. And that's essentially whenever a patient has a request, they either come to the practice, to the front desk, or they call through to the practice. Of course, that lovely trying to get through at 8 o'clock window. But if you're coming to the front desk or calling through, you will be talking to our patient services team. I've just had a question come into the chat about should we be able to hear anything. I'm just going to quickly check that. Yeah, I hope everyone else can hear everything okay. I'm getting a thumbs up from colleague there, so hopefully you can hear everything. So I will continue as normal. But yes, coming back to this traditional access. So when you have a request, you'd usually telephone into the practice or come to the front desk, and then you'll be talking to a member of our patient services team. So the patient services team are obviously non-clinicians. They're not clinical. They're not trained to diagnose or treat any particular clinical or medical issue. But what their job is to do is to direct that request to the appropriate person at the practice. Now, it wasn't all that long ago that GP practices were actually fairly simple in terms of the staff they had there, in terms of just GPs, and you just came to see a GP, but it's evolved in terms of the addition of practice nurses. We then have healthcare assistants. We've got paramedics, physiotherapists, emotional well-being support workers, so a whole varied array of different clinicians. So essentially the job of patient services team is to direct that request to see the right person, to make sure that we haven't got inappropriate things ending up with the wrong person there. So what they'll be doing is obviously either directing it internally to an appointment in-house, or they might be directing elsewhere to make use of another service. Perhaps that's the 111 scenario or urgent treatment centre. But that is an overview of traditional access. You're calling up, coming to the front desk, and it's down to PST to try and navigate the system to either book an appointment or signpost to another service. That's the access side of things. The appointment side of things for our current system is, I mean, it has this feel of basically just on the day. You have to constantly call through on the day, and that's the only way you can make an appointment. The reality is slightly different. So what happens is we add our appointments 6 weeks ahead of time for all of our doctors. Our nurses and allied health professional team, their appointments actually go on a little bit earlier than that. But all the GP appointments get added to the system 6 weeks ahead of time. And of those appointments that get added, a certain proportion of those are made available for pre-books, with the idea being that if you have an issue that isn't just needing an appointment that same day, you've got something to pre-book. But the reality is what happens as soon as we add those pre-bookables onto the system 6 weeks ahead of time is they get booked immediately. And then you're left with a scenario of essentially calling and not having anything in the next kind of 5-10 days range. And the only options is that same day or 6 weeks ahead of time. So as I said, all the appointments get added 6 weeks ahead. There is a proportion that are made free. They're often very quickly booked. But also after those appointments are added, obviously in the time span of them being added 6 weeks ahead to that actual clinic date, there are also follow-up appointments that are getting booked in. So obviously all of our GPs and clinicians are actually having appointments with patients, and a proportion of those will need to come back in for another appointment. And they will get added to it. And essentially that resulting capacity is essentially protected to make sure that we've got some appointments to release on that same day. And we're going to get into where this generates some issues and likely touch on some common cases that I would imagine the vast majority of you probably can relate to in some degree. Our overall capacity, is worth mentioning, depends on loads of different factors. Yes, it depends on the number of GPs we have and the number of days that each of those GPs work, but it is also massively limited by our premises size, the number of consulting rooms. As some of you may know, we're in the process of building some new consulting rooms in the waiting area, just finishing up with the first one, and we've got another one going in as well in the other waiting room, and that's just because we're desperate for space. There's the number of GPs that we've got here, but not just GPs, there's just the number of varied clinicians as well. The working hours, like I said, the appointment types, how long they are. I mean, obviously, it's very typical now to just have 10-minute appointments, which are really quite short when you think of what you're trying to get done in just 10 minutes. But any lengthening to that appointment time obviously has a big knock-on impact to the number of appointments that we have. And importantly, the thing around that as well is just the number of appointments that each clinician can safely deliver is not just trying to do as many as possible. You've got a safety and effectiveness question here. And what we don't want to have is so many appointments that essentially the safety factor starts dropping off, or patients start feeling rushed, or like they're not having their concerns properly met and listened to and heard to. So moving into the kind of current issues with our system, I'm going to start with a little visual, and apologies that it looks a little bit chaotic on the screen to begin with. I'm just more of a visual person, so I think it's helpful to be able to see things. So on the screen, hopefully you can see the slides, and what we have here is at the top left of your screen, where all those wonderful bright colors are. Each of those individual squares represents a particular patient's request coming to the practice each day. And as illustrated on my poorly put together little funnel diagram, obviously what tends to happen is on a particular day, all the requests are coming in a very time-bound manner. So it's essentially as close to 8 o'clock as we can get it. The requests start coming through this funnel system. And essentially because of the way our appointments are released, as I said before, you've got all these weeks of appointments in the system, with some of those appointments getting booked as soon as the appointments are added 6 weeks down the line. You've got some of these appointments getting booked by follow-ups, and then what you're left with is what's available on that same day. So all of these requests that are coming in on a particular day are getting funneled into the availability of that same day. So the issues that come from this is, firstly, this massive booking bottleneck at 8 o'clock. Because these appointments that are available on the same day, the only ones that are available, get released at 8 o'clock, it means that there's a pressure for patients to contact us at 8 o'clock or as close to try and secure an appointment, which is obviously difficult for us because there's a massive surge in calls, but it's also a really stressful and difficult experience for patients trying to call up and get their medical concern essentially attended to through an appointment. There is also disadvantage that gets created for different patient groups who may not be able to call through straight away in the morning. We've also got this limited appointment availability. So you also essentially have this extreme of just appointments just available that one day, or if there is something pre-booked, it's often the 6 weeks ahead. And a lot of our requests, or a lot of concerns that come to us, they may not need an appointment that day, but they also you don't want to leave it 6 weeks. It's the kind of question of, well, can I not pre-book for a couple of days' time? But the way that the appointments are structured at the moment doesn't facilitate that, which is obviously a massive impact on what options are available. And that ties into the inefficiency point we'll come to in a moment. We also have this really important point that it's not just about, the reason we're doing all this isn't just from the patient side of things. It is, of course, the main reason, but we also know that internally the current system places loads of pressure on our patient services team. It's an incredibly difficult role to have when we have so many calls coming through. Honestly, the number of calls is quite mind-boggling when you start seeing it and you're there day in, day out seeing the calls coming through. And they've obviously got a really tricky thing trying to direct patients into appointments as efficiently as they can, but they've got this massive pressure of all these requests piling up coming through and these appointments that are available. And obviously there's this pressure to try and get that appointment. And then when we reach our capacity, they've got the really hard job of trying to signpost to other services as well, which, as we know, can be a really challenging thing. We also have this inefficiency point that I touched on. Because the majority of our appointments are telephone first, we have essentially the need for people to come back in for a face-to-face appointment after they've already had their initial telephone call, which creates a duplicate appointment where we could have just had one appointment to begin with. The fact that all of these issues are coming through on that same day means that you'll have certain requests that actually, quite frankly, could be dealt with without an appointment. A GP might be able to look at that and see clearly that could be dealt with just a few clicks, maybe a couple of minutes to sort out. But at the moment, all requests have to kind of go through into an appointment. So you've got all these requests that could be dealt with without an appointment, having to go into an appointment. You've got essentially routine queries that could wait a few days, having to go into a same-day appointment, which means the same-day issues coming through might have more restricted access to appointments. And you've also got different queries that really require what we would refer to as continuity. This is a common thing that people say is, how come it's no longer the case where you can see your named or regular GP? And that's something that everyone in the practice would strive to have. If you ask anyone here if we would ideally like to put the same patients back to the same GP, everyone would say yes, because it just makes more sense. You build the relationship up, you understand the person's context. You might have had 3 or 4 appointments with a particular GP, and then if you suddenly have to jump across to someone else, it's almost like starting the story again. And the issue with this one at the moment is really tricky, because when those cases come through, there will be incredibly limited options of who's free to put it with. So again, there are loads of issues with the current system that I think is really important for us as a practice just to acknowledge and to say that we do fully understand and get the difficulties that exist with it. And obviously that creates a massive motivator for us to want to change it. So on that point, what did we do to go from the place of saying, right, we're not too happy with the current model, we want to move to something different? What did that process look like? And I'm going to say it has probably been about a year in the making. It has taken a lot of time and energy to come up with a new thing. There have been a lot of initiatives through NHS England to get practices to introduce what they call a digital consultation tool. That means something like e-consult. We're using Rapid Health. There's loads of different ones out there, but where patients submit things digitally. And it's been this massive push, a massive rush to get as many practices signed up. But what we know is that practices that do that just quickly as like this little bolt on, it doesn't solve any of the problems. So what we wanted to do is come at this in a considerate manner, where we're thinking about the different ways that this would impact both patients, staff, but also overall effectiveness of the system, and think about how we can go forward from there. So what did we look at? Well, firstly, our demand, not just total number of calls, but trying to filter that down into unique calls coming into the practice, both through the different days of the week, different months of the year. We had a little while ago some menu options, trying to distinguish whether issues are new or ongoing, and that comes to trying to not only look at what the total number of requests are coming through, but the varied nature of each request. No one request or two requests rather are the same. So it's trying to get an understanding of what that demand looks like, as well as just the total number coming through, and that's part of it. We sent out last April a survey to just shy of 1,400. Well, we sent it to everyone, but we got about 1,400 responses, and within that, it asked questions around what sort of time frame would you hope to be seen after raising your request with us, and a few other questions around continuity and things like that. We obviously have data on our kind of call capacity, the number of people answering calls, how many calls each person is able to answer within a specified time. We've obviously got the number of appointments on the system, both advanced, same day, big thing about like potential versus actually what happens, the change across time, so over the course of the year. We've also reviewed a lot of national data sets and research, and I think that's another important thing, is because this is an initiative that NHS England are very keen for us to do, but it's always interesting to see what's actually available out there in terms of, does this actually help? So yes, we want to improve patient access, but we want to do it in a way that's actually going to help. I've had many conversations with other practices. I've sent some surveys out to other practice managers to establish what have they done, how have they found it, have they seen that patients are much better or more satisfied with that model, how do the clinical staff feel, how do the admin staff feel as well, and generally did it meet the goals that they had. As I said, I've tried to gain a lot of effectiveness or data on effectiveness and safety, and I put the word tried there because, again, it has been an initiative, but there's not loads of published research showing how more effective this is, which is, again, the reason we're wanting to come into this with a kind of very intentional approach. We've modeled a lot of the different models, so we actually had a team session where we generated the different approaches that we could use, and we looked at how those different approaches would, what the impact would be when comparing it to our kind of demand that comes into the practice each day and each week. So there's been a lot of effort kind of looking at the different the different options out there and how they might impact the various aspects of us as a practice, but also patients as well. And from all of that, we have got the new system that obviously we're here talking about today. And it's important to say there's kind of two main areas of change when we're talking about the changes. The first is more the behind the scenes side of things, and that's the structure and format of our appointment diary. It's the introduction of more face-to-face appointments. It's the introduction of more routine capacity, so appointments that release in a more tiered fashion, so it's not just all right 6 weeks or same day. And just really carefully considering how that looks over the course of the week and time. Now, that isn't going to be the focus of today, but that is a really important underpinning of the change. The second part of what we're going to be talking about today is how requests are actually going to be submitted to us and processed by us, which is obviously the most important thing from the patient's perspective there to kind of get stuck into. But an important note at this stage is just to say, in order to get the benefit of that structure and change to the appointment system, we are introducing this new tool to do that. So the new tool isn't just about trying to have a fancy digital tool and just to try and push everyone digital. There's nothing about that. The main goal of this is to try and get better information about the nature of each request to then fit it with the kind of change of our appointment structure itself. So how does that look from an access point of view as a bit of just an overview? Well, we've got the patient request as we had through the traditional model at the start. That request can come in 3 different ways, and this is really important to stress right now, is there is a big concern when you talk about introducing a digital tool or a form, that what are you going to do for those people who have difficulty accessing things online or perhaps don't have access to online services. For instance, they may not have a smartphone, tablet, or computer, or even have access to internet full stop. And the thing to stress here is that we are not going to be trying to disadvantage those people. Anyone who cannot use a digital form can still call the practice as they would before. They can still come into the practice as they did before. So we're really trying to stress the fact that it isn't the only way. It's a new way, but it's not going to be the only way. So with these 3 different ways that requests can be raised, they will all be using the new Rapid Health tool that I'll be showing you in a moment. And the reason for that is, again, is because we're trying to get better information about the request itself before we direct it into an appointment or somewhere else, just to make sure that we're kind of trying to use the system as best as we can. Again, there's a variety of requests that come in that could be dealt with without an appointment, and we want to get the context surrounding that so that when we look at it, we know that that can be done without needing an appointment afterwards. So all of these avenues will be utilizing the Rapid Health tool. So that's whether someone is doing it themselves, the tool that we'll show you in a moment, or perhaps you're doing it on behalf of someone else, whether that means you're coming into the front desk. And just for context, what we'll be doing around the front desk situation is we will have 2 check-in stations, so essentially 2 tablets set up in the surgery as you come through, so that you can do that and also ask for some assistance if needed as well. You can call through, as I mentioned, and if you do call through, our team will take you through the questions and the form that we're about to have a look at on your behalf. But when we do that form, what we'll have is essentially, if that request is appropriate and completely suitable for an appointment, well, it will just automatically give the patient the option to book an appointment. And that's configured based on how we've set the system up. But importantly, the request will also come to a central inbox, which is going to be managed by our triage team. And that will be through in-house GPs as well as our patient services team. So again, the whole point of changing this element is the fact that it's not having just all the requests coming straight to the patient services team who have to act quickly about this pressure of dealing with it right there and then. Again, they're not clinicians. They don't have the clinical knowledge or experience to know what questions they ought to be asking or clarifying to figure out more detail. We're trying to get a better understanding of the request right at the front end, have a look at it, see where it needs to go. If it's urgent and needs same day, it goes same day. If it can wait a few days, then again, it's having that judgment about it. So it's not got this pressure of just trying to process everything into that same day. And from the inbox, again, it'll be a case of either scheduling an appointment internally, perhaps just doing something immediately that he can sort out, whether it's just issuing a medication, sorting out a form, or perhaps directing to an appropriate service that'll be better able to deal with that request. So that's an overview of just the kind of process. What it will be helpful to do is actually show you the form itself. So I'm going to just stop sharing for a brief moment here and then start sharing the form. So just 2 moments whilst I do so. Okay, just going to do a quick check that we can see that. So hopefully what you can see on your screen now is a welcome page to what is Rapid Health. So essentially this is the digital platform, the form that we'll be using. And again, I'm going to be showing you what this looks like, but if you're someone that would struggle doing so, or if you're thinking of perhaps families or friends or people that you know that would have issues doing that, they can still call through and it'll be the team internally that will be taking them through this form. The way that you access this form, importantly, is going to be through one of 2 routes, the first of which is the Moatfield website. So we haven't got the link live right now, and that's simply because we haven't gone live yet. We're planning to go live on the 10th of March, so not very far away at all. But as soon as you go onto the Moatfield website, there will be a joining link at the top, right on the homepage, so that you can access the form through a link there. In time, Rapid Health will be integrating with the NHS app. So if you are a person who uses the NHS app, you will be able to access the Rapid Health portal that way as well. But importantly, you don't need an account or an app installed to get to this. You just need to be able to get to the website if you're doing it yourself. Again, I'll stress, if you aren't able to access online services yourself, you can still call through or come to the practice in person. So as I said, you'd go to the website, click on the link, and you'd come to this welcome page. So we have various different areas that it could go, hopefully fairly intuitive. The first one being adult medical requests, which is the side of things we'll go through in just a short moment. We've got medical requests for children, so any patients under the age of 16. The reason that's separated apart is simply because the automated feature I mentioned earlier, where the system is essentially looking at requests saying, yep, that's 100% appropriate for an appointment. Let's offer some appointments based on that. We don't want to necessarily be doing that for children requests. We just want to be looking at it ourselves. So it's just separated so that the practice team can get an eye on those before anything's looked at afterwards. There is a question and admin section, as well as a self-help information section as well. I'll come back to that one in just a moment. So again, you've come to the welcome page. We're going to go into adult medical requests and just click select there. The first thing it's going to do is just confirm that you haven't got any sort of major red flag symptoms that is going to suggest that actually, do you know what, that request shouldn't be coming to us. It should be going to an emergency service. Again, most people you would imagine who are completing this form aren't going to be in a position where they're choking right now. If you're in the position where you're choking that second, you'd imagine that someone's probably calling 999 or trying to get more urgent help. So we'll confirm that we have none of these. And then what we are met with is a search bar. And this is one of the important features of why we went with Rapid Health as opposed to some of the other options. A lot of the other options have like very rigid pathways. So for instance, you would go onto the particular tool's website or app, and you'd only have like a few different options to pick between. And then it's really hard as a patient to know which one's appropriate. This one starts as just an open-ended text box where essentially you'd just be entering in your main symptom or complaint and searching for it in your own words. Importantly, it doesn't matter if you have some slight spelling mistakes with this, the system will pick up what the nature of the question regarding. I've got two just quick examples I popped through just before starting up the call, but we can put through anything else as well. So what you would do is essentially you're going to search for what your particular issue is. I'm going to pop something else. Just going to pop something else different in there. So let's say that my knee's painful. You would then click enter or click search. And then what it's going to do is if it finds a perfect match, it would pop up in this top bit, but it will always give some alternatives. And the reason it does that is because it doesn't want to strong arm you just down one certain pathway, just in case that's not quite the right one. So what it's done here is it's given a selection. The top one is muscle and or bone or joint problems. And if you're wanting to clarify whether that's the appropriate one or not, you can click on it. And when you click on it, what you'll see is it'll have a list of things that it's suitable for. So for instance, here it's saying an other joint, so including knee, hip, ankle, or thing, pain. So we would think, okay, that's the appropriate one. If we look at that and we're in that list of what it's suitable for, we can click select. If we don't, maybe we're in this list of not suitable, we can hide that. We can have a look at the other options and see which is the most appropriate one. If there's nothing that feels like it matches very well, importantly, there's an option down here at the bottom, which is a general pathway. So if you click on that, you can select that and it will just has an avenue, meaning that it doesn't have to find the perfect fit. You have got this general pathway that can be used if none of the options above feel like they match. Now, Rapid Health probably has the most pathways out of the different options available in terms of products and tools out there. So most of the time we'll find one that is appropriate, but I think it's nice knowing that there is an option in case we don't find one that matches. I mean, like the way that everyone will be searching for their different symptoms or complaints will be very different. I mean, requests don't really often fit in perfectly nice, neat boxes. So it's nice knowing that there is that kind of just a bit of a safety net of if it doesn't fit there, there is somewhere else to go. But in all the testing that we've done, typically there are options that exist for that. So I am going to use one particular pathway in particular for this. I'm going to search for something else, and this is something people can do as well, is if they want to change what they're searching for, you can just delete that and re-enter it. And let's say I'm going to go for mole that's increased in size. Again, if it had a perfect match, it'd be popping up there. For instance, I'll just quickly search for sinus pain, and then there's an immediate match that jumps up right at the top, but it'll always give some other options just in case that isn't the right one. So I'll go back to this search. It'll have the options that it suggests that might be appropriate for this. By clicking on this skin issues one at the top and looking at what it's suitable for, and just having a read through that, we can see that it is suitable for mole issues there as well. So when you find a pathway that feels like it's suitable, we're going to click select. And when we click select, the next bit is just going to be confirming your details. So obviously the way that we've accessed this form is just through the website. And that means that anyone could potentially click on that link and start the process. But obviously for us to provide care to the person completing it, we need to make sure they're registered with us. So it'd be a case of entering in things like date of birth, name, address, and bits like that. And then what we'll do is click next, and essentially it's going to check to make sure that those details match those of a patient registered with the practice. So if If it didn't match, it would immediately pop up just asking you to check the details to see whether or not you just misspelt, put a spelling mistake in there, or perhaps the wrong date in there. But once we've got it matched up, we can start the process, and I'll be showing you through what this includes, and I'm talking through it, so we won't read through all of that, but we'll just click next. And then this is what most of the pathways will consist of, is a series of questions and the ability, essentially either drop down or multiple choice answers to answer the question that you're being prompted for. So in this case, we've got a mole that's changed in size, shape, color that we suggested, but obviously all the questions that are generated here are going to be different depending on that pathway we selected. And importantly, what the tool will be doing is, as you're answering these questions, if you put a response that is indicating perhaps there is a high level of urgency around this case, is it might ask some further questions around that. Or perhaps the way that you've answered one question, it will ask a couple of more, or it will remove some. So it's basically moving with what you're entering to make sure that the questions that are being asked are the most appropriate ones it needs to ask. So for instance, if I click change in color for this mole, it will then ask how is the mole changing color, whereas if I don't have that, it won't ask it. And I could select multiple ones. So where I'll just go backwards. If I click change in size, it will ask how it's changed in size, but I could also say it's changed in color too, and you'll be answering both of those questions. So it will be a case of moving through the questions that relate to that particular pathway. Based on your answers, it will be adjusting and moving things around. And really importantly is if you selected one particular pathway and it's not quite right, it might move you to a different pathway without you necessarily having to change that yourself. So it is using what's being provided to adjust based on the different responses being provided there. And then what essentially is going to happen is when you get to the end of the form, the whole job of what this tool is doing is it's trying to get a better picture on that request itself, and then it's trying to understand how urgent that particular request is, whether it needs to be dealt with that same day, whether perhaps it needs to be dealt with by at least tomorrow, whether perhaps actually it's okay for as long as it gets dealt with within the next 5 days, or maybe it's less urgent and it needs to wait a little bit longer. It's trying to classify how urgent it is, and then we as a practice have gone through all the various pathways and said where different things need to go based on the pathway and the urgency. And what that means is essentially we can adjust for what we feel is going to be appropriate, but we have tried to enable patient choice as much as possible in that. So again, we've got to the end of this form and there's going to be one of two things that are going to happen. The first is we're going to be getting a selection of appointments that will be essentially available to be booked directly by the patient, or it will be submitted to the practice's inbox to be reviewed. So if we click next there, so in this case, it's given us 3 different days, and by clicking on it, it's given the appointments that are available. Importantly, there's this little telephone icon showing appointments which are telephone based. So those with the telephone icon will be telephone calls. And by the way, this is just a dummy platform. I'm afraid we don't have appointments at 6 o'clock in the morning. I'm not sure if anyone was desperate to get down to the practice for 6. So it's just to say all of these are based on a dummy platform. But as I said, you can click on each individual day. You'll see the little telephone icon for the ones that telephone. Without it, it's face-to-face. You could select the GP that you have a preference to see. Again, this is just a dummy platform, but perhaps you would like to see Dr. Forrest or Dr. Fielding. You could select that, see what's available for them. And importantly, the appointments that are going to be available are going to be in a time range that's appropriate for that request. So if it's something that's really urgent and needs to be dealt with that same day, it will only show appointments that are available that same day. Whereas if it's something more routine, well, it's not going to just show that one day, it will show what's available over the next coming days as well. So it's trying to match it based on what's actually sensible and what's needed there. So again, what I'll do is I'll just select one here. It will confirm the details of that. And when we click confirm, what we'll do is the appointment will be booked and that confirmation will be sent across via email to the patient. So that's one of the outcomes that can come from that. I'm going to quickly stop sharing and go back to the slides here. 2 moments. Come back to there. Okay, brilliant. So that is one of the outcomes, is just being able to book an appointment. The other thing, as I mentioned earlier, is it might prompt to say to submit the request to the practice. And that is in cases where we've set it up where we just want to have another little look at it, just to make sure. For instance, one example of that is the chest pain pathway. If something's classified as really urgent under the chest pain pathway, we'll want to see that first, just to make sure that actually it is really appropriate to be with us as opposed to going to an urgent care service. But they are the 2 outcomes of that form. It'll either be directing to an appointment that patients can book into themselves without it needing to come to us, or it will go into the inbox for further review. Now, the whole general point of these forms is they're for non-urgent requests, meaning that theoretically anything that requires urgent medical attention or emergency care ought to go to emergency services. So from a contractual standpoint, we need to respond to anything that comes into the inbox within 48 hours, but realistically, we'll be looking to respond to things within that same day. So if it goes into the inbox, you'll receive confirmation that it's been sent to the practice for review, and what will happen is our triage team, that includes the GP as well as our patient services team, will look at that request, and then we'll get in contact with you. Either that be booking an appointment to let you know that something's been prescribed for that, or perhaps just calling up for a little bit more information. Perhaps they're asking for a photo to be sent, things of that nature as well. So that's a bit of a demo of the form. There's one other little thing I will show quickly, because I didn't on the last one and we did get a question about that. So I'm going to quickly, once again, apologies, hop back over to this form. And that's just to say that the self-help information section, the way that that would work is if you are just wanting some guidance or information about a concern that you might have, it's all linked to the NHS website. So again, confirming that we have none of those. Again, if I type in, let's say, back pain, it will link into the NHS website for guidance around those particular areas. So if you are just wanting to get a bit of information rather than actually put the request to the practice, that avenue is available there as well. But just thought I'd quickly share that. As I didn't the last session, that was one question that came up to see. Right, so coming back then, that is going to kind of come to an end of showing the tool itself. In terms of if you have any questions or want to find more information, of course, our website, we have the information on there, and we're doing updates on that platform as well. There is a feedback form that gets reviewed, so we wouldn't be necessarily responding to individual feedback forms, but if you've got any concerns or comments or thoughts that you'd like to share with us, please do share those through the feedback form. Obviously, follow us on social media, and then we also have the recorded session of the first one that we've done, and this one recorded, and it is on the Moatfield Surgery YouTube channel or on the website. I'll quickly show you where on the website you can find that. So if I come onto the Moatfield Surgery website again, if you just simply Google Moatfield Surgery and click on the website there, you can go onto appointment information, how to book an appointment, and then if you just scroll down towards the bottom of the page, what you'll have is the 2 sessions. Obviously, we're doing this one now, but you can click on the session recording if you'd like to watch the one that we did back on the 12th. So with that in mind, I think we'll turn our attention to some questions. So let me just quickly flick back over here. But before I do so, just a massive thank you for everyone. I know it's a lot of information. It's a big change for us as a practice to be making. I think the point of doing these live demo sessions is to really try and make sure that we're explaining what we're doing and why we're doing it as clearly as possible. We want to try and provide as much reassurance as much as possible that this whole process has been incredibly rigorous. I've had calls with West Sussex Health Watch, for instance, to review how we're doing it to make sure there aren't any particular patient groups that would be disadvantaged by the service that we're having. There are more things that we feel could be better about it as well, and we're using this start point as just that. It is a start point for us to continue to learn, review, and get better. One of the big issues with the existing system is it's really hard to change it or to make slight changes. So this will allow us to kind of do future changes much more easily and without so much difficulty as the current one has in place as well. So a massive thank you for everyone that's joined today. Again, if you do have any questions, pop them in there. I'm going to have a little look through now. But just, we are grateful for everyone's involvement with this and feedback. There have been some great questions and points raised at earlier points that have fed directly back into this process. So please, just because we're going live on the 10th, which is terrifyingly just a week and a bit away, does not mean it's too late to put some feedback across to us as well. So with that being said, let's have a look at the questions. I imagine that a lot of them would have been answered. So I'm just going to go through from the top where I've got it. So I have a question here. Can you complete this form anytime, or does it only open at certain times of the day, i.e. 8 a.m.? That is a very good question. And the honest answer to that is we aren't sure at the moment. The goal for this, and I will say that is very much the goal, is to try and have this open for a much longer length of time. One of the issues with the current system is because the only available appointments go live at 8 o'clock, there is that pressure to get there at 8 o'clock. So what we want to try and move towards is these tiered release of appointments. So it's not just everything's releasing at that one point, and to try and smooth that access to make sure that you aren't having to get through bang on 8 o'clock. So the question around like when will it open? Well, that will depend on when we do facilitate that form. We'll essentially update everyone with that next week, but the goal will be for it to be open for a longer length of time. Again, like I said, in an ideal world, you'd have that open the whole time, just to have a nice, steady, smooth flow of requests going into where they need to go. The one big consideration, though, around that is just the overall number of requests that come in. A big part of our kind of analysis of which approach is better is the point around just sheer volume of requests that come into the practice. And whether or not we've got the capacity to safely process all those requests. We could easily just have it open the whole time. But if we have, like, let's say, 400 or 500 requests that triage team is going through, we want to make sure that they're making safe, sensible decisions that are actually helpful, and it's not turning into a churn of just having to just process requests for the sheer sake of it. And we actually want to make sure this is helping the situation. So in terms of when it will open, the goal will be for as long as possible, but we will have to have that as a bit of a learning curve to see how that looks. But the one key thing is we're desperate to move away from that 8 o'clock peak demand, and no matter which way we'll do it, we will, if we're having to have a cap on the times it's open for, we will definitely be having a morning and an afternoon one as well for people that aren't able to get their request in at 8 o'clock. There's another question is, what if you have more than one condition you require attention for? You would just put in another request. Unfortunately, the tool isn't quite advanced enough to be able to get like detailed understanding of each of those together. So it'd be a case of popping it multiple forms through. Got another question. What if you have trouble spelling? Like, for instance, if you have dyslexia? Again, like I said, the key thing about that search bar is it's a smart search bar. So if you spell things wrong, it will still pick up on what you're trying to do. If you're having difficulty with it, you can still call through the team as well and just talk to a member of our patient services team who can help going through that. Just having a little scroll here. When you insert your symptoms, does Rapid Health know automatically from the description that you either need a telephone appointment or face-to-face? Another good question. So essentially, that is all how we've configured the mapping out. So when you pop your symptom or query in, and then you're selecting that particular pathway, essentially what we've done is say that, look, if it's this particular issue and it really just needs a face-to-face appointment. Like, there is no need for a telephone. Like, it's not going to be dealt with a telephone appointment. We will set it up so that the face-to-face appointments come through first for that. So essentially, where there are really obvious clear-cut cases, we'll be guiding in that way, but we do want to enable patient choice as much as we can. So for a lot of the scenarios, there will be both options open, because for a lot of the time, people generally know what they need for their particular issue as well. Let me have a little scroll. Sorry, basically I just have to keep refreshing this and just make sure we've got everything covered here. When filling out the triage form for family members, for example, children, is it therefore best to use the website form? If not, would it mean having an NHS account open for children? Not sure if that's possible, at least for under 15s. So if you're doing it, it'd be the same thing if you're doing it. Again, you won't need an account. The point about NHS account is just it's another avenue rather than it just being the only central way. So that web, accessing it through the website, you can do that just if it's for yourself or you're doing it on behalf of someone else as well, whether that be children or perhaps you're caring for a parent or a partner. You can do it through the website and you don't need an account as well. They're just integrating it into the NHS account because some people find that that's what they've got and that's what they use all the time. So it's just having another option available as well. Got a question, does Rapid Health use AI? This is all about the AI is obviously a huge thing at the moment. A lot of it's algorithmic based, but it will be using AI to a degree, particularly that search functionality of picking up which pathway is correct and moving the questions around it. So yes, there is an element of AI within Rapid Health. Just going to quickly do a refresh. If you've got any questions, do ping them in. We've got 5 more minutes, so do pop them through. Yeah, I mean, not a question as such, but just got a comment saying that must be an improvement on the stress we all feel at 8:01. Yes. I think this is really important. I don't believe that the system we're moving to is going to be a perfect system that magically improves all the issues that we know to exist within the NHS. I would love it if it did, but that's just not an achievable goal. But what we do know about this is that it certainly can be better than the current system. And we know that the current system generates a lot of issues. And what we're wanting to do is within the realms that we have is focus on improving those aspects to make it better rather than just saying, well, we're not going to be able to make it perfect, so there's no point trying. Well, we know that there are issues that get generated, and that's why we're wanting to change. We've got the follow-up question about the AI. What about data security? Rapid Health has had to go through a very, very rigorous process to get their tool certified as a medical device. It's one of the rare tools to have done so. In the onboarding process, we've also had to go through and get data protection impact assessments in place, and we've been working with our data and governance team surrounding this as well. So rest assured that essentially everything that could be covered around that is in place and signed off. How will we know if our form has been accepted for that day, or are we too late? So when you put that through, you'll just receive confirmation that it's been sent, obviously, and the goal will be any request that comes through on the day will be processed that day. Ultimately, there is theoretically within 48 hours, but if we aren't able to get it done that day, we would communicate that to you. But our intentions is very much to make sure that all the requests that come in that day are dealt with that day. So you would know, we would communicate with you. Got a question that's more specific about condition. I would ask you to give the practice call regarding that. I'm afraid this one is just regarding the new system change, unless I've misread that question. Okay, are there any other questions? I don't believe I've missed any there. Just do a quick double check. If you've got any new ones, feel free to ask them. I believe that's all of them. Okay, brilliant. Well, in which case, what we'll do is we'll wrap things up there. So just a massive thank you again to everyone who's joined the call. One little last thing, I don't think we've had any questions come through. So yeah, massive thank you to everyone. It will be a learning curve for us. We will be aiming to improve this as we go, but we do believe this will be a step in the right direction. So just appreciate the difficulties that patients face. Believe me, we would like to be able to resolve that instantly, and we really hope that this is a step in the right direction. But yes, massive thank you to everyone. But I shall let you all go. A lovely rest of your Thursday evenings. Yeah, just if you have any questions or concerns, just get in touch with the practice.